Today we're going to be talking about speech and language disorders. I'm Darlene Rose, a certified and licensed speech and language pathologist. A speech pathologist is also known as a speech therapist, and they play a very vital role, often as part of a team working with a number of types of disabilities and disorders. We provide services in clinics, in rehabilitation centers, in hospitals, in universities, colleges, and also in private practice, as well as in schools. It's our role to identify, to evaluate, and to treat patients with speech problems, language problems, cognitive problems, as well as stuttering problems, voice problems, and swallowing problems. Today we will discuss various types of disorders with a goal not only of increasing your awareness of these problems, but also giving you some insights and some information as to how you as a caregiver can be helpful and supportive. It's estimated that 1 out of every 5 people in the United States has a speech, language, or hearing problem that impacts communication. And communication is vital to life. It connects us to what is most important: our families, our friends, our jobs, and our recreation. Your skill with patients will develop and improve with experience. You know, it's not always what we say, but how we say it that matters most. The term for this is nonverbal communication. Your tone of voice, your facial expressions, even the way you touch a patient, all communicates an honest sense of caring. There are some strategies that can be used to help you communicate more effectively with your patients. Look directly at the patient as you speak. Listen attentively. Ask relevant questions. And do not interrupt. The process of speaking itself is controlled through a speech center located in the front part of the brain. This center exists only in the human brain. When we speak, the sound of our own voice comes from the vibrations of our vocal cords. The voice originates in the larynx, or the voice box, which is the upper end of the air passage to the lungs, and is located in back of the Adam's apple. The larynx, in cooperation with the mouth, the throat, the windpipe, and lungs, work on the same principle as a pipe organ or an oboe. Through this system, vibration is set into place, which causes sound. Over 100 muscles are used in the saying of a single word. The speech and language process can break down, and it breaks down for many reasons. Common causes are brain injury, cerebral palsy, traumatic accidents, and stroke. Each year, 730,000 people have a new or a recurrent stroke. If the speech and language centers are impacted, as a result of the stroke, aphasia may result. Aphasia is a disorder that impairs one's ability to understand and or express language. There are 3 types of aphasia: expressive aphasia, receptive aphasia, and global aphasia, which involves both receptive and expressive aspects. Aphasia can range from being so severe that little or no speech is understood or spoken, to being so mild that the only difficulty may be in finding the right words to express yourself. If the left side of the brain is damaged, the right side of the body is paralyzed, and vice versa, because the nerves cross to the opposite side of the brain. In addition, speech is affected if the damage is on the left side of the brain in a right-handed person, or on the right side of the brain in a left-handed person. For example, I am a right-handed person. My speech would be affected if I had an injury on the left side of my brain. In addition to aphasia, there are many other causes of speech limitations. Some of these are the neurologically degenerative diseases, such as multiple sclerosis and Parkinson's. Also trauma, chemical abuse, and surgical procedures. An example of limitations to a patient with Parkinson's would be reduced vocal volume. Speech and language limitations can be very frustrating, not only for the patients, but for you as caregivers, as patients are limited often in their ability to make their wants and needs known. There is a variety of communication assistive devices. 3 examples include the sound level meter. The sound level meter displays the loudness level in decibels. The voice amplifier, which assists the hard of hearing. And communication boards. Communication boards have keywords and pictures which assist the patient in communicating. Some patients also use very special types of electronic devices.